I think my life story, at least according for my career, is never say never. I said I didn't want to be a doctor, figured out, okay, I was wrong. This is actually what I'm passionate about and what challenges me. Same thing with neurology. So I'm hired on to be a general neurologist, but I'm actually specially trained in neuroimmunology, meaning inflammatory autoimmune diseases that affect the central nervous system. The most common conditions that end up in my clinic are probably migraines or some different form of headache syndromes. I see a lot of neuropathy, so a lot of the numbness and tingling, which also includes some of the radiculopathies, we call them, meaning rather than the nerves themselves, it's the nerve roots as they come out of the spinal cord that get affected, and they share very similar symptoms. I also get my fair share of concussion patients, of course, and as well as memory patients. And in this age of kind of post-pandemic, we've been seeing a lot of our long COVID patients as well. So I end up seeing a lot of patients present with symptoms like decreased endurance, exercise intolerance, heat intolerance, numbness and tingling, and fainting, where they stand up and they just don't feel well. Most of what I do in terms of treatment is medicine driven. So that most of the time it involves pills, something oral, whether that's vitamins for migraines, for example, or actual prescription medicines to treat those symptoms. For more specialized conditions like MS, for example, you do have more infusion driven medications too. Then it's a pros and cons discussion, side effects, logistics, involves a needle. Some folks are really phobic when it comes to that. So really coming up with the treatment plan. I do a lot of therapy referrals, so physical therapy, occupational therapy, speech therapy for our cognitive therapy. My strengths is just communication in general. I get back to patients pretty quickly whenever they message me. I love to read. That's probably one of the biggest things about me. It's every time we travel, my sister always says, please get away from the bookstore because she knows I'm going to stay there a long time.